On this video, I'm going to be showing you how to complete a reassessment or a reeval. So I clicked on the tab that was scheduled for a reassessment on the patient's record, and it brings you to this page, is the first page of it. This is the patient information page. This is everything that was on the referral that was sent to you will be right here. So once you look over that, you'll hit the next green button down here at the bottom. Okay, and it'll pull up the subjective part of the note. This is anything that may have stood out in your therapy session. Also, a couple of questions that you always need to be sure you ask the patient is if they had any ER stays, new wounds, falls, or new meds. And that will need to go here. Once that's filled out, you'll hit the green next button. Okay, vitals is another thing that's always needs to be addressed. We will put those here. We always need to check the heart rate, blood pressure, and respirations, and O2 saturation if we have a doctor's order for that. Once that's filled out, you'll hit the green next button. Okay, pain is another area that always needs to be addressed. It has a drop-down box right here where you can put yes or no if they experience pain. And you have the option to use the pain rating scale or the FACES scale. Whoops. Okay. And then you can change the intensity. We'll put that she's at a 4. And once that's filled out, you can get more specific with it, and it'll ask you the location, onset, and frequency. Once all that's filled out, you'll just hit the green next button. Okay, and medication, this is where you'll put if the patient is on any new meds. Here. Next. There it goes. Okay, and this is living arrangements. So you can get detailed about the patient's home. It's a drop-down box. We'll just put that she has throw rugs and she lives in an apartment. So once that's all filled in, you will hit the next button. Okay, and this is the cognitive status. It goes into detail with short-term memory, was it intact, visual comprehension, problem-solving skills, was the person oriented to person, place, and time. And once that's all filled out, you'll hit the green next button again. Okay, in the sensory portion of the test, it can be seen here. Visual, perceptual, motor skills. We'll put that they were intact. If you selected what you need, you'll hit next. Okay, sensation. We have for left side and right side, light touch, pressure, temperature, and pain. And you have the drop down boxes as well. You can just select normal or abnormal. Okay, next. Okay, coordination. It goes into detail with these, right side and left side. Pretty easy. We'll hit next. Equipment assessment. You can put if the patient has a rolling walker or anything like that. It gives a drop down box. So, and once you add all the equipment that the patient has, you're going to hit the next button. Okay, ADL self-care skills can all be found here. Okay, gait mobility training, level surface, unlevel surface, all of that can be found here. Stairs, curb, and if it's not applicable, you can just check that and it'll take it off. So we'll hit next. Okay, this is the muscle strength section, and it gives a couple boxes for upper extremity, lower extremity, or any other additional information that you would like to put in there. Okay, and then balance, sitting and standing balance. And then it gives a list of tests, standardized tests that you can use. You can open those to fill those in. Every eval and reassessment needs to have a standardized test with it. Okay, transfers can be found here. Again, it's just easy drop-down boxes. Okay, exercises. This is a pretty neat section because it allows you to go in and select which body area you need. We'll just put elbow. And you can select the exercise, and then you can go in and individualize it to that patient. And once you have all the exercises that you want, it will be displayed on the patient's chart. And then the assistant that goes out to do the treatments can see them as well. So once you have all your exercises selected, we'll hit next. Okay, and then special instructions. Wound management, if you did that. Okay, prosthetics can be added here. Okay, and here's the outcome-based quality improvement levels.